Good evening, everyone. It's Rebecca Treadway here with the ARC Northwest Mississippi. Thank you for joining us for our information session. We're joined tonight by Sarah Watson. She is a supervisor in support coordination at North Mississippi Regional Center, and she's going to share a lot of information with us tonight about the waiver programs, the Medicaid waiver programs, and support coordination. So thank you for being here with us, Sarah, and go ahead and take it away.
Thank you so much, Rebecca. I just want to start off by saying I cannot thank you enough for everything you've done with the flyer, with getting the information out. That has been so helpful to me, and I appreciate your time and dedication in doing that. I really do. Everyone for being on here tonight. It really means a lot because this information is so important to me. And there's so many people who don't find out about waiver and waiver enrollment until it's so late in the game. So I really want to help make some awareness by getting this information out and available in a more clear way, because I know it can be confusing and it's a long process of getting enrolled in waiver. So I want to make that as clear and concise as I can. That's really my goal tonight. So I'm just going to get started. I have a short PowerPoint, but just jump in anytime you have any questions or anything, and I'll shut up and you can just let me know. So okay, I'm gonna get the PowerPoint pulled up now. I'm gonna try to share my screen and see if I can connect it with you guys too. I'm still kind of new to this part of social media or media in general. So if it doesn't work, I'll just read it.
So are you seeing, are you, when you're pushing the screen, is it the screen share, is it working for you?
It's not.
Okay, I've got it enabled. So at the very bottom of your screen, there's a green thing that says screen share. Do you see that at the bottom?
I do.
Click that, and does it pop up a window with lots of screens in it to choose from?
It does. Let me see. I'm gonna see if I can open up it in another window, and if I can get it on that way. All right.
Here you go.
Okay, everyone see it? Good, okay. Awesome. Okay. So just a little bit about me. I started off out of college working at the Regional Center as a direct care worker from 2016 to 2017. And in winter, early 2017, I came to the support coordination department as a support coordinator. And recently I transitioned into the role of quality assurance coordinator. So my position has shifted a little bit from primarily working with individuals and their families to more of a hands-on training with our support coordination staff, making sure that they know everything, the ins and outs of what they need to do to be supportive. I went to college at Blue Mountain for undergrad. I have a Bachelor of Science degree in psychology and a Master of Science degree in community development from Delta State. And that's just a little bit about me. I'm really passionate about developing communities and just making sure that, you know, any information that I can give, anything that I can do to help, I am more available even after the training. If there's any questions you have, feel free to call, text, anything, and I'm here. So just to give a little bit of a background about the regional centers in Mississippi, there's 5 regional centers. There's the North Mississippi Regional Center here located in Oxford, South Mississippi Regional, Hudspeth, Boswell, and Ellisville State School. So where the individual receives services is based upon their county. So if you live in any of the northern 23 counties, we call that our catchment area. For the North Mississippi Regional Center, that's what I'm personally most familiar with. But It really just is designated by where you live. So say for, not to jump ahead, but say for example, so you get into waiver services and you live in Oxford, Lafayette County, and at some point down the line, you have to, or decide to move to, I'm from Biloxi, so Biloxi area, that would be moving to the South Regional Center catchment area. So there's a few different eligibility factors for waiver, and you can read through these on the screen. Income up to 300% of the SSI federal benefit rate, SSI eligibility. And a lot of the time families get a little bit confused that I work with, especially if they're, middle income, higher income, as to, how are these services going to help my child if I'm not eligible for Medicaid. But waiver bases all of the services off of the person's income. So that's always an important distinction to make, that, if anything ever were to happen to you, it's important for the person, your loved one, to know that they can receive services regardless of anything affecting your income. It's all based off of their income personally.
Hey, can I ask a question real quick?
Sure.
I'm sorry, this is Kirby. On the previous screen where it said you have to qualify for at least one of the things listed, like my son, he has disabled child living at home Medicaid. We just recently got our research to do, and they told us that if he did not qualify under SSI disability, he would not get disabled child living at home Medicaid. So is that still separate, or is that kind of changing? Because that was all new to us this year.
Okay, and that might be something that's changing. I'm not aware of anything that's changed recently, but I would be glad to get some more information to you about that to make sure that that's clear.
Okay, thank you.
I know earlier this year when I was at the Capitol, there was a lot of talk about changes in the disabled child living at home waiver. They were really, really focused on income level at that time. They felt like, well, so changes are happening. So I know that is a concern, but we do need to stay abreast on it. So I'll try to look too as well, Kirby.
Thanks.
And as far as the definition, people hear waiver and but they might not know exactly what a waiver program is. So here's just a short definition that I came up with. The IDD waiver program is offered by way of a joint effort between the Mississippi Department of Mental Health and the Department of Medicaid. So what it does is it waives the regularly allotted amount of services of funds. So what that means, just to break it down, if there's any services we offer, sorry, that's our intercom. But we offer multiple services through the waiver. So for example, you could get an attendant coming into your home. We call that home and community supports, where they would take the person out into the community, and they would also help them at the home with like bathing and self-care tasks. And you could get that in combination, if it's approved by bid, and we'll get into that in a minute, in combination with other services like specialized medical supplies, receiving diapers and blue pads at home. So you can receive multiple services that are, the requirements are waived, so you can receive more than you typically would with regular Medicaid. So I hope that makes sense. And we have here, that bid is our governing authority. So the process for waiver enrollment, after you have accepted enrollment, when your name comes up on that statewide planning list, that's the next step after you complete that diagnostic evaluation. We do have a very long waiting list, and that's the hardest part of my job, honestly, is telling people, receiving calls, telling them it's going to be that 7 to 8 year wait list. That's a long time. That's a really long time. But once you receive that letter in the mail that your name has come up on the waiting list, the next step for us to schedule that,
Okay, I have a question. So, back in January, I took my daughter down to the North Mississippi Regional Center, and we were there from like 8 a.m. to 4:30 in the afternoon. Is that what this is?
yeah, that's going to be that diagnostic evaluation where they'll
Yes,
ask
yeah,
every
they said
yeah,
that she qualified for the home and community based.
yeah, that's
So
it.
that's this.
Yeah, that's it.
Okay, just clarifying. Thank you.
You're welcome. And there's two different waiver programs that we offer here. There's the 1915I waiver, and then we're the 1915C waiver. So I'm sure they made that distinction when you all enrolled of which one you're eligible for. A lot of the time, while you're on the waiting list for the 1915C waiver, they'll let you into the 1915I waiver so that you don't have to have a complete lap in services for that 8-year time frame. So there's a few factors after enrollment that can lead to discharge from the waiver. So we'll go through those quickly. Admittance to a nursing home or hospital care facility for longer than 30 days. Now, we can do what we call a temporary discharge from the waiver. So we can let you know we're getting you out, but we're getting you right back in so that there's no double billing or overlap with Medicaid. But if it's for continued amount of time, that can result in waiver discharge. Moving out of the state of Mississippi can result in discharge, loss of Medicaid coverage, decision to discharge. If at some point you decide, this isn't what we want, this isn't the program for us, then you can absolutely make that decision. And then failure to maintain any enrollment agreements. And those enrollment agreements are, we talk to you once a month. If you have legal guardianship, we have to touch base pretty regularly, at least once a month, to be able to monitor the services and make sure that everything is going smoothly, that there's no issues, that you're receiving the services that you need. And that's usually about a 5 to 10 minute phone call or as needed. If you ever have any problems, you can always contact your support coordinator.
Let's talk for a second about number 3. Let's just focus on number 3 for a second. I'm going to make a statement about it, and will you tell me if I'm right or wrong about what I'm saying? So I'm guessing you would lose your Medicaid coverage. How this happens is you are on the IDD waiver, but you work a little bit. You have a little bit of work that you do, and you end up working too much, and you end up losing your Medicaid, and then you're off of the waiver. So is that correct? That's how it usually happens?
Well, usually that can happen because it is based on income limits. So if you work too much, you're going to get that justification not being eligible anymore. Usually what happens with my experience is a family will forget to fill out a form, and we'll just get that. It'll be something related to a form, something simple that they can clear up, and it's usually resolved in a few weeks, but
I got it.
Yeah.
Okay.
And just to define what a support coordinator is, a support coordinator is a facilitator of the plan of services and supports. When you come into the waiver, it's not quite as long as the diagnostic evaluation, but it is pretty lengthy. We have a plan of services and supports meeting, and in that we define things that are important to the person, important for the person, going to doctor's appointments and so forth. And we make it into this big packet of information. So you're going to get a complete report of everything. We try to have a snapshot of the person's life. So it'll have your family information, family dynamics, medication history, current medications, outcomes, things that you want the plan, and the services that you're applying to receive, of how you want those to support you in your daily life. So
I've been on a couple of these meetings for other people before, and they're very thorough and informative. It really helps the case manager, the support coordinator, really understand your loved one and know what they need and know what they want in their life.
I have another question.
Good.
I'm sorry.
No,
Okay, so just to verify, this is completely separate from the packet of information that I was mailed with the results of when we went down there.
Yeah, it's a separate.
Correct? This is
You're gonna have that.
separate. Okay.
It's
At
separate.
what point do we do that? Because my daughter turns 18 in June.
Okay.
So at what point do I need to call and schedule this meeting? Will they contact me?
They'll
How do
contact,
I go about that?
they'll contact you.
Okay.
Yeah, when their name comes up on the planning list to be next in enrollment for waiver, someone from our
Okay.
department will contact you and we'll schedule that.
Okay.
so,
Thank you.
but Catherine, your daughter is going to start accessing services on the 1915I before
yeah.
she does the 1915C. And on the I, there is not support coordination. Is that
Correct.
correct, Sarah? So she's going to get going with Medicaid services on the I. It's good services. It's just not as deep and as thorough as the
Okay.
C is. So it'll be a few more years. She'll already be doing a day program, some other little things, and then you'll get the call, and they'll be like, "You're ready now. We're ready to put you on the full program," and that's when it will happen.
Okay. Thank you.
And a few things about the role of support coordinator is implementing that plan of services and supports, and being advocates for that person within the community. So making sure that when they're going on community outings or when they're in the day program, that they're getting what they need and they're getting the supports that they want. Because that's really our goal, is to make sure that just like you or I, my personal mantra, anything can happen at any time. So like for example, I have a sister-in-law who's in the elderly and disabled waiver. She had a sudden stroke and it just happened one day and we had to get her on a waiver program. So it's all about putting yourself in that person's shoes who's receiving waiver services and thinking, well, if this was me, what would I want? You know, watching TV is important to me. You know, going to the mall or listening to music is important to me. Then that's something that I wouldn't want to have to live without. So it's making sure that those important shoes are accessible to that person. And just a few things that support coordinators do monthly. They're packed. They do monthly contacts. So getting in touch with those families and those people on a monthly basis, scheduling quarterly visits and annual provider visits. So a quarterly visit is going to be when the support coordinator will visit you at the home with a person face to face so they can see them, talk with them, check up on them. And they also will go to that provider. So if you, for example, just choose Mill Creek as your provider of day services adult, and that person goes there during the day to receive assistance, you know, hands-on daily living skills and maintenance, then that support coordinator will go by and visit and evaluate, you know, are they doing what's on the plan of services and supports? Are they making sure that person receives quality services? So, and review the utilization report on a monthly basis. That tells us how much or how many hours of services that person is using. So when you come into the waiver, you're gonna work with your support coordinator to determine how many hours of services that you want to receive, request to receive. It's not guaranteed to be approved, all the hours that you request, but it's all based on that support level that the person has. And that's based off of an ICAP assessment that will also be done as part of the waiver enrollment process.
And how many hours does a person typically get on the waiver?
Yeah, so let me scroll down. I have a chart for that. Is this showing up for everybody?
Yes.
Okay, great. So it's based on their ICAP score. So if they have a support level of 1, then they're going to receive typically about 43 hours a month of services as an entirety. 2, if they have a designated support level of 2, then they're going to receive an average of 55 hours of in-home services a month, and they're designated to have pretty low support needs. And it goes up to very high, a level 5, we call it, and receive an average of 116 hours a month.
Mhm. Great chart.
Thank you. And there's an ICAP assessment that's done. It's a long list of questions that's done in conjunction to the PSS meeting. Your support coordinator will, well, the ICAPs are divided between support coordination and ascend management. So either your support coordinator or an independent contractor is assigned the case. They're supposed to be more objective. We'll complete that assessment and they'll ask you a list of questions ranked from 0 to 3. 0 is going to be never, and 3 is going to be regularly the person is able to complete those tasks well or not very well. So it's just going to go through a list of motor skills, of social skills, and that information is compiled to bring that support level. All right, any questions or anything? No. So I'm just going to run through the different services that support coordination or the waiver offers. So we have behavior support. If your loved one has behavior episodes, hitting, fighting, then we can request for a 3-month evaluation to be done and conducted in order to assess that situation and see if they're in need of behavior support. And the behavior support service is conducted by a specialist who comes in, works with the family and the person to decrease the frequency of those behaviors and just help everyone be safer and more aware of strategies to use to avoid those. We have supported employment, and the service provides individuals with assistance maintaining community employment once it's been secured. There's also a component of support employment called job development, where we work with that person and figure out what their employment goals are, what they want to do in the community, and then they transition into job maintenance usually, and that's maintaining that job, maintaining that role in the community, so like a job coach. And day services adult, it's typically from around 8 a.m. to 2:30 p.m. and it's equivalent of like a daycare day center where they'll learn self-care skills, daily living skills. You know, I had a person in my caseload a couple of years back, and they were teaching him how to fold clothes, do laundry, do just different tasks in the home.
So I'm just going to interject right here. Currently in DeSoto County, we have 4 day programs. We have 2 that are run by Mill Creek, 1 in Hernando and 1 in Olive Branch. The Helping You Bridge is run by Region 4. We call it the Hub. That's in Olive Branch. And then REM Blossoms is in South Haven. And then just a little bit away, we have in Senatobia, Climb at the Baddour Center, in front of the Baddour Center. The only thing about Climb is that it's too far away from us to have transportation, that if your loved one is going to go to Climb, you have to transport them. But lots of people do because it's pretty great.
It is. And we have home and community supports. That's a service where someone will come into the home and help with different day-to-day tasks, bathing, cooking meals, and keeping that person safe, so being there during the day. And a big component of home and community supports is taking that person out and into the community. So if they love going to Dollar Tree, like a lot of people in my caseload do, or Walmart, or just any number of different places, they'll take them there as well. And there's no limit on the amount of time that they can spend in the community. There's a similar service I'll get to in a minute called InHome Respite, and they have a limit of 1 to 2 hours out in the community, and the rest is geared at the home. And there is occupational, speech, and physical therapies. So once we've exhausted regular Medicaid and we either can't find a speech therapist or usually just can't find a speech therapist, then we can apply for that service to be provided through waiver. This provides living services. It's somewhat similar to a group home. It allows individuals to be more independent than a group home setting, but transportation is provided to different places in the community, so they can, similar to home and community sports, they can go out and do what they want to do, but they'll have a place to come home to. They'll have that supervised living home, and that's usually roommates, 3 to 4 roommates on average.
And I'll just interject right here one more time. In DeSoto County, Mill Creek has a large array of homes. I think they have 9. They have 5 girls and 4 guys, but they might have added 1 since then. The homes are so nice. They're nicer than, like a lot of parents will say, my child will always live with me. And I'm like, well, then don't let them see the homes, because they're going to want to live there when they see them. REM Mississippi Blossoms, they have 1 home for men as well, and I think they're working on getting a female home at this time. So
I love visiting Mill Creek's supervised living homes. I used to have DeSoto County on my caseload, and they are just gorgeous. They are beautiful, and they do such a great job of maintaining the home, everything down to the furniture, the decorating. Yep. It's really impressive.
Yep, it's pretty wonderful. I'm going to pause for a second here. Sonia, I see that you have your hand raised. I'm wondering if that's an accident. Okay.
No.
Okay, stop. Okay, Sonia.
All right,
Quick
I have a question.
Okay.
Going back
So
to
I see
adult
that
day
it
service.
says that it's based on the days that they live
Hold on.
there. So let's say that my daughter is a full-time resident there and we decided to go on a week vacation. Would I be able, would her spot be secure when she comes back from vacation?
It would, just as long as they're aware. You just let them know ahead of time.
Okay.
Hey, we're going on vacation. We're going on a trip. We'll be back in a week. It's no problem.
Okay, thank you.
Go ahead, Sonia. Ask your question.
Okay, I'm going back to adult day services.
Okay.
Is that something, so Jenna has not come up on the waiver program. She probably will in the next year or 2. Is that something that she would have access to while she is still in school during summer months, or is that something for people that have already graduated beyond high school?
Yeah, you have to either graduate or have that certificate of completion first.
All right, that's it. Thank you.
And we have community respite services. It's similar to before and after school care program. So if you have to go to work pretty early in the morning or you have to stay pretty late in the afternoon, you can apply for community respite, and that will give you a place for your loved one to go. It's usually at the same day services that they're gonna go in around 8 a.m. They'll just go a bit earlier or stay a bit later. So it's a before and after care type program.
Sarah, I guess that's what my question was, because during the summer right now, when I was working, she either came to work with me or had to stay here for a few hours by herself. So is there anything available to them while they are still in school? What were you saying about that?
Yeah, not community respite. I can check into it. I think it has to be used in conjunction with services actually, okay. But I'll get you some more information on that.
Okay, thank you, Sarah.
You're welcome. And host homes, we don't have any providers for this service yet, and it's really not a functional waiver service, but it's approved on the list, so I'll go ahead and share this one. If you ever want to, take into your home someone with a disability, it can be done. It's similar to an adoption process, not as lengthy or, anything like that, but it is a service that it is approved for waiver.
I know other states, that's a really big thing. I know I have a cousin in Pennsylvania that is on their 1915 C waiver there, and he lives in a host home. So just don't have it going on here, but it does happen a lot in other places.
That's wonderful. A crisis support. So if you're ever in a crisis situation, we can request for a 30-day stay. It's usually at Boswell Regional Center here in Mississippi. And after that process is, it's usually based on a behavior episode the person has, and they have to be taken out of the home, put in somewhere more secure while they can be safe and treated for that. And they can, integrate back into the home, back into the community. And crisis intervention is very, very similar to crisis support. Crisis intervention is more targeted towards like a one-time behavior episode, a one-time behavior crisis where that person has to be removed. Crisis support is more of an ongoing service for ongoing episodes. In-home nursing respite, if your loved one is in need of medical care, you can request for a licensed nurse to come into the home and provide those assistance. The difference between, and something that we have to stress with support coordinators a lot, is the nurses, only nurses can administer medication, and HCS providers or in-home respite providers can't touch medication or any sort of feeding equipment, specialized medical supplies, unless it's, changing out, bed pads, blue pads, that kind of thing. They can do that, but it's really excellent to have a nurse to provide that care when it's needed. And supported living, so for individuals who choose to live in their own apartment, or their own home, we have supported living. It's very similar to HCS, whereas someone can come in for a few hours a day or for a week as it's approved by bid, and assist that person with like financial management, writing checks, learning how to drive, so that they can continue residing in that home and having that independence. Transition assistance. So for our individuals transitioning out of institutional settings, we offer an $800 allowance so that that person can buy personalized comforters, personal care items, anything that they're needing to be able to make that transition a little bit easier. So that situation where a person would receive transition assistance would be if you're out here at NMRC in one of the cottage type settings and moving into the waiver from that capacity, then you could be eligible for transition coordination or transition assistance. Pre-vocational services. So if your loved one is interested in employment skills training, like resume building, community employment, pre-vocational services is somewhat similar to day services, but it has a focus on applying employment skills. So they'll learn how to interact best with an employer, or kind of what skills that they would need to perform that job successfully in the community. And it's similar to a classroom setting. From the few that I've seen, I know Mill Creek does theirs as a classroom type thing. So. And job discovery allows your loved one to receive assistance with attaining community employment as well. So job discovery gets pretty confusing. But what it is, let's say that your loved one doesn't know exactly what job that they want to pursue. Job discovery service will go in, they'll have a coach who will work with that person, take them out different places in the community and really introduce them to what the community offers for employment. If they want to work, fast food restaurant, if they want to work with animals. I used to work with someone who absolutely loved pets, and I always remember enjoying getting to go to the animal clinic and visit with her and see just what great things she was doing there. So specialized medical supplies can include catheter equipment, blue pads, and diapers in various sizes. In-home nursing or in-home respite, like I said, it's similar to home and community supports. The only real difference is that community outings are limited to a max of 2 hours a day. Shared supported living. So this service is similar to supported living, but it's designed to support multiple individuals residing in the same residence. So instead of one person living in an apartment needing some extra help, you might have, 2 or 3 people. And this reviews the support levels that the hours the PSS is approved is based off of. And here's the references we used. So that's all.
I want to ask you a question, Sarah. I always talk about the perfect week when we're talking about people. Like, what's your idea of the perfect week? So tell me if this is possible. You are on, say you're on the IDD waiver, and Monday you go to a day program. Tuesday, you have a worker that comes to the house and takes you on an outing to go volunteer at a food kitchen, and then you go to Walmart or some other store. Wednesday, you're back at the day program. Thursday and Friday, you work at Zaxby's with supported employment. Is that a possible combination? Can that happen, or is that too complicated?
No, that can absolutely happen.
Okay.
I've seen that happen. Yeah.
Good. Because I feel like that really is that is the perfect thing to be able to have all of those services together.
Yeah. And it's beautiful to see them working so well in conjunction with each other. People usually have a few different services on their plan, so it's never just, I won't say never, but it's usually not just one, it's a few.
Does anybody else have any questions? Letting everybody have a minute to get brave.
Hi, this is Glenda.
Hey, Glenda.
I'm here supporting Sarah. Sarah, you did a wonderful job.
Thank you. Hi, Glenda.
Hi.
Hi. Well, thank you guys. Any other questions or anything before we wrap up?
We know that we can get a hold of you at NMRC. I will share your email in the session description so people can know how to get a hold of you to ask questions. Is there any information on when the application for service will go back up on the website?
Not that we've received.
Okay.
But you can contact the diagnostic department. They would be the ones who'd have that information.
Okay. All right. Well, Sarah, we really appreciate your time. Thank you so much. We're glad you were able to help us. All right, everybody. Have a great week, and I will post this on our website under virtual workshops for everyone to come back to as a reference.
Well, thank you so much.
All right. Good night, everyone. Bye.
Thank you.